Okay, so hi everyone, it's me again, Gorby. And for today, we're going to talk about headaches. So if you're someone who's feeling pain, discomfort, and irritating, excruciating pain here, 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 here at the back of your head, this post is for you, this video is for you. So I hope you can watch and listen until the end of this video. So first thing that we would like to discuss or talk about with regards to headache is that almost every one of us will experience it during the course of our life here on earth. So common contributing factor for pain on our head is stress, but there are different sources that can cause the pain on your head or the headache that you feel. So we'll be talking about those things, but mainly I wanted to deal with the pain that physiotherapists can help you with, which is a pain that headache that originates from your neck. Oftentimes, especially for those of you who are working at home or in the office, in front of your computer and laptop, sitting like this. So this area, the back of your neck, tends to be tight or stiff. So the joints and the surrounding muscles and soft tissue structures around here at the back part of your neck underneath your skull become stiff and tight. So joining us today is our model, so I can explain to you how it can produce or give us headaches. So again, if we're on a posture that is collapsed on our upper back, so we're like this, the tendency is for our head to tilt back going on that direction. And if you stay here for a long period of time, the joints and the muscle gets tight or it stiffens up. So showing you the model, this is the upper back, this is the neck, this is the skull. So if we're collapsed here in the upper back, which is some sort of like that, your neck or cervical spine will compensate going towards this direction. And then all the areas here will be locked up. Now, this area, the upper part of your neck, there are nerves that exit there and they supply the area around our head and face. So if these joints are stiff, it will tend to compress those nerves supplying the area on our head and face. Thus, it will create a noxious stimuli or a painful sensation on our head. Specifically, around here in this area, all the way down towards here. Okay, so like I mentioned earlier, there are different types of headache. Now the question is, how do we know if my headache comes from the neck? So there are a few things you can do. Best thing to do is number one, go and see a professional for them to have it checked and for them to know what the source of your headache is. But if you don't have access to that and you wanted to check and somehow have a relief on the headache that you feel, these are the things that you can do. So first thing is assessment or testing. So what you need to do is number one, for us to test if it's really the neck that is causing the pain, is for you to bend your head and neck fully. Your chin should be touching your chest. Now if you cannot do this motion, it just means that this area right here, especially if you can't chin tuck and touch the chin on your chest, that means this area at the back of our head, the upper cervical spine as we call it, tends to be tight. Now, second thing that you have to do once you fully flexed it already is for you to turn your neck very slowly towards the right side and that side. And then note and feel the difference. So again, chin tuck, bend your neck, hold it here, and then rotate your neck left and right. Now, normally for people who have good flexibility or joint mobility of the upper part of their cervical spine, or the part of their neck, normally they can rotate their head up to 30 to 45 degrees of rotation. So that's normal. So if you can do this without any problem, you don't feel any difference between the left and the right side, that means that it's probably not the neck. But if you feel a stiffness here at the back of your neck as you turn, and you feel that you can't go any further, there's a block, it could mean that the area around here is stiff and is causing you headache. So for people who experience headache that originates from the neck, they can only rotate their head up to 15 to 17 degrees. Okay, so now let's go with the treatment. So with all the different types of headache, either migraine, tension type, or a headache that comes from your neck, common thing all of them have is those people who are experiencing it are experiencing a high amount or an enormous amount of stress. So the first tip that I will give you is, number one, for you to be able to learn how to manage your stress. So that's tip number one. Now, there are a lot of experts giving their advice on how to deal with stress. I will share with you my process, or how I look at it and how I manage my stress. So basically, I just get a piece of paper. If I'm stressed that day, I get a piece of paper, I write all the things that will make me happy. And then I will try to do those things. That's it. So if this is okay, second tip, or tip number two, as I said earlier, this part, especially for those of you who are experiencing a headache that comes from their neck, if you feel stiff when you try to do that test of bending your neck and rotation, the second thing that we have to do is we need to stretch or lengthen that part or area. Because if that area is stiff, again, it will compress the nerve that supplies the area around our head and face. So how do we stretch? So it's very simple. I want you to place one hand at the back of your head here, and then the other hand on your chin. And then from here, you're just going to push your chin back, creating a stretch here at the back part of your head. So side view, one hand over here, one hand over here, and then try to push. That will create a stretch here, the back part of your neck. Now, a variation, if you don't feel that much of a stretch when you do that, you can also do this stretch. So earlier, I asked you to place one hand behind the neck or the skull or the head. So now we're going to place both hands. Okay? And then from here, you're going to tuck your chin and then bend your neck. And then from here, just like the test, you're going to try to turn your neck towards the right side, feeling that stretch here, the back of your neck, specifically the right side, if you turn on the right. And then turning on the left, you will feel also a stretch on the left side. So that's the second variation or modification for you to be able to stretch or lengthen this area. So two things you can do. You can do it by repetitions, meaning from here, bend, tuck your chin, and then rotate, rotate. Or you could do holds. So from here, bend, bend, and then rotate your neck, hold for 10 to 15 seconds. And then do it on the other side. So it's very important for this stretch that you are able to tuck your chin back. Okay? Okay, so for the third thing, or the third tip, is for us to prevent falling on this posture. So we have to strengthen our neck for us to be able to hold this neutral posture. So I'm going to give you a strengthening exercise right now that you can do at home for you to be able to strengthen your neck so that it can prevent going into this posture. Alright? So I'm just gonna move away farther from the camera, but I hope you can still hear me for me to be able to demonstrate the exercise well. So we're going to be in this position on all fours. So knees bent. And then from here, the tendency is for our neck to go like this. Now the exercise is very simple. I just want you to tuck your chin back and hold this position for at least 15 to 30 seconds. And relax. If this is too easy for you, what you can do is add arm movements. Now, the focus is not exactly the arm movement, but for you to be able to sustain your head on a tucked position. Not falling like this, it should be like this. Or moving your leg.